Hello, it's Peter Wright and Kathleen Beauvais with another episode of the Yakking Show. As always, we bring you interesting guests. Today is no exception. A quick note before I introduce co-host Kathleen, hang around to the end because we will give you news of who's coming on next week, and that should be interesting too. So first, let's introduce co-host Kathleen. Hi, Kathleen. How are you today?
Oh, I'm doing great, Peter. Thank you. And thank you also very much for tuning in to our show. We so appreciate having you. And as Peter mentioned, we do have another guest with us today. We are so privileged to welcome Elli LeClair to the show. Hello, Elli. How are you?
Hi, Kathleen. I'm great.
So has been a registered nurse for 50 years. Congratulations on that, Elli. It's quite the
Oh,
milestone.
thank you.
And has experience in the ICU as well as emergency care. Her compassion for the elderly has brought her to educating others about Alzheimer's dementia, which has become a personal family endeavor with a desire to speak to the general public about this devastating disease. And I couldn't agree with you more, Elli. So let's just jump right in. What is one thing you would like people to know about Alzheimer's disease?
Well, with Alzheimer's and dementia, I believe that people don't understand that Alzheimer's is a form of dementia and that with Alzheimer's, problems in our brain can occur up to 20 to 30 years before we ever even have symptoms, which is mind-boggling because we think it only occurs with elderly people. Well, that's not true
Right.
because it's not a part of aging. It's not natural to get dementia,
Right.
but there are all kinds of factors that come into our life that bring on these injuries and bring on these different problems that cause the neurons in our brain to just kind of move apart from one another so they don't connect. Everything from injuries to car accidents to sports that people are playing these days. So Alzheimer's, if there's anything that people can just take away from this to think, look how far back it can happen in our brain and that we don't even know about it. So we're not even aware of it back in our 20s and 30s. We're not going to give up. That's not a problem for me. I just got bonked on the head. I just got injured in sports.
Mhm.
So that would be a very crucial thing about Alzheimer's. And with Alzheimer's, too, compared to a dementia that people experience, is that these long-term memories are major problems for people. They can't go back and remember when they were a child, for example, or that when they went to or they got married or any other long-term kind of things that they experienced. Those are gone. And that's so unfortunate because with dementia, different forms of dementia, usually it has to do with short-term memory where people don't remember. What did I have for breakfast this morning?
Right.
When they're asked, but they remember way back. They can remember 50 years ago, their childhood memories. But with true Alzheimer's, they don't remember those. That cognition is gone, the thinking, the knowledge. Who's president of the United States, for example? They would not remember that. And that's the sad part of Alzheimer's to people who have it and just struggle to remember and they can't. It's very frustrating for them.
Right.
Wow.
And
Uh,
sorry, Peter, I just wanted, so you're saying that Alzheimer's disease could actually be present in the somebody in their 20s and even 30s, or begin as early as
Yes,
20 and wow,
exactly. Well, those are injuries that occur to the brain.
like
You
concussions and such.
concussions, exactly. And the concussions, which are now really pretty well advertised on news programs, on high school sports. This young guy got injured in football. They're called CTE or chronic traumatic encephalitis.
Mhm.
We don't know that that has occurred unless they do scans. They have to do
Mhm.
MRI scans and that sort of thing. But those occur generally with people who have major injuries. That can occur with sports. It'll occur with accidents, motor vehicle accidents, those kinds of things. But when I'm talking about with Alzheimer's 20 to 30 years before, it's really important to go back all the way to infanthood. Isn't that crazy to
Mm.
think that a child who falls, off the couch kind of thing
Mhm.
and sustains a brain injury, that stays with the person. Now they have a brain injury. And so we have to protect this brain from the very beginning, from the time they're born
Mhm.
into the time that they're doing their sports and riding motorcycles and making sure that people have all the gear that they need to protect that brain. The
Right.
brain is headquarters to our being, and we need to protect it from the very time they're born. We're born, but we don't know that. We don't think that can be occurring. That's why with Alzheimer's, when you say what's that one thing, Alzheimer's again can occur right from the very, very beginning of our lives.
Wow. Interesting.
Wow.
Mm.
Yeah, that is very interesting. And I think back, I was a horse rider for most of my life, and I think of some of the crashing falls I had on horses when I wasn't wearing a helmet of any sort
Mhm.
and
Mm.
motorbikes.
Right.
But Ellie, what concerns me is that the incidence of Alzheimer's and all forms of dementia seem to have increased exponentially in the last 20 years. Now, I guess some of that is better diagnostic tools, better awareness, but I still believe there's something else. And I'll make another observation, and that having lived in Africa in the third world, where dementia was rare amongst the native black population in southern Africa, who did not eat Western food, most of them didn't have electric light, they didn't have TV,
Mm.
they did lots of physical exercise, and they actually lived on relatively poor diet, but they didn't eat fast food. So there was a totally different lifestyle and they also had fewer vaccinations, where I believe my observation was there was far fewer cases of dementia. So am I onto something that dementia and Alzheimer's are on the increase because of Western lifestyle? Is it a condition of of an affluent lifestyle, or not necessarily?
Well, I think many people fit into this category of why is there an increased incidence? And it has to do with we still have a major problem with obesity in the United States and other countries as well. But coming from being in the United States, that's where I can come from. Obesity is really considered to be a major problem. Also, diabetes.
Hmm.
Now, if we can decrease the obesity rate, we can decrease the diabetes as well. And all of this is inflammation in our system.
Mm.
Inflammation travels through our blood vessels and it goes to our brain. That is where it lands.
Hmm.
So that inflammation is what is causing these neurons to, be having a problem and not being as good as they're supposed to be attached to those synapses that make things go. So with inflammation, that's really kind of a number one.
Hmm.
Diet is, as you mentioned, diet is extremely important. And as I go along a little bit further to explain about diet is just so crucial for Alzheimer's dementia patients that we need to restrict the fats as much as possible, but do the good fats. It's not like we should get rid of all red meat.
Hmm.
We should not eat this, not eat that. It's very confusing for people, I think,
Mhm.
too. But you're mentioning the diet, and I say obesity, diabetes, and you talked about better diagnostics. Yeah, we have better diagnostics now to bring people to the primary care office where we have better testing, but we have better knowledge of that testing
Hmm.
because primary care persons are really not best suited and it's nothing against them. I love my primary care physician, but they have not been truly educated in that level of diagnosing dementia. So, but looking at all these other factors, risk factors, really bring, to light, keeping down blood pressure. And that is, to keep down our blood pressure is really important because there's another form of dementia called vascular dementia, which can occur with people who've had these mini strokes. And sometimes we don't even know that that's happened. And then blood clots form and cause inflammation. And where does it go? It goes to through our blood system and goes to our brain. So there are just so many factors that
Right.
can affect that, why dementia has increased.
Okay.
It's finding it more too, and working with patients who have it, identifying it really.
There's I read a study very recently that showed a very distinct correlation between the increased prescription of statin drugs since the 1970s and the increased incidence of dementia of all forms. Very close correlation. Now, they didn't prove causation at all, but it was significant that those two graphs moved in parallel from the 70s to now. Do you think there's a connection there as well because of statin reducing cholesterol? And as you've just said, we need good fats. You think they're onto something, or is it purely coincidental?
Well, I think with statins, they're not the only culprits, as we would say,
Sure.
with medications. But doctors are wanting people to have their cholesterol lowered. So we need to look at what are the underlying problems that we can't get our cholesterol down. We don't need to go directly to the statins
Hmm.
and go to drugs that, cause more side effects or have untoward effect to our brain. So statins can possibly, and I don't know, Peter, all the details about that. I'm not either a pharmacist or a physician, so I'm not as familiar with that. But there are drugs that, ditropan, for example, along with the statins, ditropan, which is used for patients who have urinary incontinence.
Hmm.
That is a drug that the doctors don't even always tell you, but when you look it up yourself, that is one drug that you say, hey, where's the closest open window that I can get rid of drug? Because it's not good for my brain.
Right.
Wow.
It's good for one part of my body, but it's not good for
Not
my
the
brain.
other.
Right.
Wow.
So, Elli, on your website, you talk about three main foci even before dementia is diagnosed. Can you talk a little bit about that?
Well, I was looking at the three different areas that we need to identify dementia. Dementia can't be just noted that, oh, this person just has a memory problem, and daughter's going to bring in the mom. She's just been having memory problems lately. Okay, well, we'll diagnose dementia. There is so much more to it. One, they need to go to their primary care physicians. And as I mentioned just a minute ago, the primary care are not your, specialists. They're not your persons that you will end with. They're your beginning.
Right.
Those are the people that we go to when we have our colds, when we have our, problem with asthma, various different things. That's our primary. But the primary may already have some things that they look at from a dementia standpoint, because every person here in the United States, anyway, who go to the doctor and you're 60 years and plus, they do at least two different kinds of testing. And that is when I walk into the office, the person, the medical assistant or the doctor will say, okay, I'm going to give you three words. I want you to remember those three words. So you're thinking, all these three words. How am I going to remember? And you feel so bad. Oh, are they going to think I have dementia because I can't remember? But they give you those three words. And then at the end of the visit, they say, oh, by the way, what were those 3 words that I told you? Well, it's really kind of funny, and not funny, haha funny, but kind of strange that when they give me those 3 words, what am I doing through my entire visit at the doctor's office, trying to remember those words?
That's right.
So I'm not even concentrating on what the doctor is telling me with, we have this new blood pressure medicine for you, and this is what I want you to do. So anyway, that is one. And two, it's called the clock test. The clock test is they have you draw a clock of a 12-hour clock, and you put in the numbers, 12, 3, 6, and 9, and so forth, and then fill it in. And then they'll ask you to do a certain time, such as it's 10 to 3. It's 5 after 6. So those are just the very, very basics, but they're so important because a lot of people with dementia cannot do that. So
Okay.
this is one with your primary. So people need to go to their primary. And there are some other tests that the primary probably has done as well. We need to look at underlying problems, and the primary does a lot of that. Vitamin deficiency is.
Ellie, I'm just curious, what is it about the clock test that is so difficult for a person with Alzheimer's? Like, what can you explain that? Like, it hasn't to do with memory, but what is it exactly that is not jiving in the brain for
Well,
them?
they may not be able to see the numbers. They may not be able to actually factually look at and face those numbers. Sometimes people can't, with dementia,
Mhm.
see a person's face. And so they're looking at these numbers and saying, can you identify that that's a 9, this is a 3, that's a 12 and 6. And now, without looking at a clock that's already filled in, you have to fill it in. And sometimes they just cannot associate those numbers with an actual time. So it's probably a lot more deep than that because neuropsychologists use that and neurologists use that testing, and they're pretty, interested in how the patient does with it.
Right, right.
Interesting.
Okay. Yeah.
And then you said
So,
there were 3. So
yeah.
what was the third one?
Well, actually, the second one, that was the first. This is the second specialist. Now, the person has to go to a specialist,
Hmm.
and those specialists are a neurologist, neuropsychologist, and well, could be a neuropsychiatrist as well.
Mm.
So that would be your second group of people who are specialists who really need
Okay.
to look at this person and see if they have dementia. The third is those specialists will order MRIs, CAT scans or CT scans, or even PET scans. Not so much PET scans because they don't think that PET scans will be, for one, they're not paid for by insurance, but the others are. So
Mhm.
it's a matter of identifying, does this person have something on the brain? Do they have a tumor? Do they have a bleed? Do they have something else going on? And you can see, if there is something irregular, that's very relevant to dementia. What's
Right.
going on?
Mm.
But to be clear, Alzheimer's can't actually be diagnosed by an MRI machine, though, right?
Right. But they can see the different they can look at these neurodegenerative things that are going on. If the
Mhm.
synapses are not connecting, they can look at the hippocampus, which is that major part of the brain that houses long-term memory. They can see if that has shrunk. Yeah, that's the word, shrunk. So they can see various different things, but they can't say, yes, that's exactly Alzheimer's.
I
You're
see.
right. Yeah.
Yeah.
Okay.
Okay. Wow.
Wow.
Ellie, I've been, because we have a great interest in longevity, we were reading a report about the blue zones, what they call the blue zones around the world. And there's 5, I think, where many more people than the world average live to 100 and live to active lives to 100. And they've identified a few factors. Diet is important, but it's not the only one. And the diets that those blue zones use are quite varied. In fact, some are heavy on fish, some are heavy on fruit. the other thing, the two that are common to all those blue zones is one is physical activity late in life. Many of those people keep doing manual work into their 90s or beyond. And the big one is socialization. That was, they thought, the strongest indicator of a community where you will find more than the average living to ripe old age of 100 or more. So why is socialization so important in delaying the onset of dementia or Alzheimer's?
Well, there are a couple of factors with that. And one, when they did check these blue zones for the areas, the geographical areas, they had epidemiologists, they had other specialists doing studies to find out what those commonalities were amongst these people. And some you've already mentioned, and that is diet. They did mostly plant-based diet. They did do a lot of exercise, of course, just general getting up in the morning, and I have a lot of work to do. So they have a purpose in life, and
Yep.
having a purpose really gets people going. And it's part of their exercise, but their thought process of being with other people, socializing with the community. Maybe some of these areas also work together in maintaining what they're doing, like working in the fields, for example, in some of these other countries. But also with the diet, that plant-based diet wasn't as specific that it was only plant-based, but they limited the amount of red meat that they had. They did do a lot of meditation, and they did also have spiritual community as well. So that doesn't mean that is religion. They went to church or they did, that kind of thing, but they were together and they had a spiritual connection that means so much to people to be able to have that. And with dementia people as well, people who have always attended church services, how important that is. And sometimes that just falls right off when they end up in a assisted living or a nursing home. They just don't do those things.
Yeah.
But here, these people who live to 100 are doing all of these things. That connection is there. Socialization, if you just about any place that you will read about dementia, Alzheimer's, you will find that socialization, diet, and exercise are the three main components. Yes, they're the three main ones. But these blue zones, places like Japan and Greece, I think was another. And actually in the United States, one place, Loma Linda, California, had these, it was considered to be a blue zone.
Okay.
Though it's not scientific, it did show those commonalities, like I said, as to why these areas are doing so well.
Right. Right.
Interesting.
So at what point should signs that a loved one may be developing a cognitive impairment prompt a discussion?
Those are varied. So depending on where the person is at in their life at this time, some people have dementia or Alzheimer's starting when they're still working. They have a job, and then they might have some issues at work from a safety standpoint, from a problem where if they're working with numbers and they're having problems being able to be cognizant of what their job now is. But also, if you have family members who are checking in on their loved ones and they find a lot of safety issues, they walk in on mom and they find that she is doing things with the stove that is very unsafe, that cause a fire. There are bills laying around on the table and not paid. So these are kinds of things that prompt. It's very difficult. This is one of the more difficult things that caregivers or children of adult dementia persons have to do. Or also if they notice that they are still driving and they get lost. They can't find their way back in familiar places. So these are all kinds of things that would have the loved one, really kind of check in on, saying we need to start this conversation, and not do it alone if there are other siblings as well, but
Mhm.
not to gang up on this person, because that's what they'll feel like.
Mhm.
You're telling me I can't drive anymore. I've been driving for 50 years. I've been living alone for all this time. I can do it. So we have to be gentle, kind, and compassionate when we're doing that. Taking away the keys is a big deal, and it really can make a relationship sometime
Mhm.
until you do it the correct way.
So how
Wow.
would you approach a parent, say that you're noticing some changes, noticing some memory losses, just noticing patterns of change that they're probably not even aware of, but maybe you should discuss those with them. How do you approach a topic like that?
Well, it's not always the topic itself. As I said, it is different with different people needing to be approached, but you always have to do it with kindness, compassion, understanding, and bring it back upon yourself, not blaming the other person. Look, you've had 2 accidents already. You have fallen twice already. Just show your concern of their safety and bring it
Mhm.
back upon yourself rather than talking
Mhm.
about that fall they had as their fault. It's your
Okay,
fault you fell.
right.
You would look at, well, let's just change these scatter rugs out in your house, and it'll make it easier for you to walk. So it brings the positive rather than the negative of what happened. She fell, got to get rid of those scatter rugs, or she is doing things on with the stove and forgetting to turn it off, that kind of thing.
Mhm.
That will take it to another level that you may have to turn those burners off and get rid of the gas in the house.
Mhm.
Something as serious as a safety issue like that, you have to do what's necessary. And you tell them what you're doing, of course, all the time, but you never blame them
Right.
for what their problem is. It's the
Sure.
disease, not the person.
Okay. All right.
Wow. So there's a couple of different types of dementia, though, significantly different. Correct, Ellie? What are a few of the main types of dementia?
Well, one we've already addressed, and that is Alzheimer's, is a
Sure.
form of dementia. And then there is one that is called frontotemporal um, dementia. There's Lewy body dementia. Now, that's about the third or so most common dementia, but not mentioned as much. Lewy body is when people have hallucinations, actually,
Mm.
and they think everything is real. They are hallucinating, and they may even act out on these hallucinations, which causes them to be at high risk for safety.
Mm.
They may end up walking out into the street. They may be told that they should follow this person in that dream that they had, and they act those dreams out.
Wow.
Then there is the vascular, as I think I already mentioned,
Hmm.
and that's if people have strokes, and sometimes these minor strokes, you don't even know you have it. You may have some dizziness or feel like a person's going to faint. And then they are checked out and they have areas that show that they had a mini stroke. And then those clots just kind of stay there and end up causing inflammation to the brain. And
Hmm.
that inflammation is what just takes off and really causes havoc with our brains,
Wow.
and can have problems with that neurodegenerative uh, process that needs to happen
Mhm.
with all of our neurons connecting and making things happen. And that's where there are speech problems, there are eye problems. So, depending on where those neurons are a problem in our brain, we can have issues walking, talking, and thinking. So, it's not just the process of thinking
Right.
or not being able to remember, so having memory issues. It has to do with just how we function throughout the day, walking, getting up out of bed, that kind of thing. So our whole being is affected by our brain. That brain
Sure.
is just it's very important, obviously, but can't stress it enough. How to
Right.
take care of it. That's the part.
Right. Now, how can a person deal with a parent that has cognitive impairment without getting too frustrated with them? What would your advice be?
Well, understanding what the disease is, becoming educated is really important. And that's my goal, is to educate people that what the disease does is not your parent like they used to be, and that they will not be as they used to be.
Mhm.
You can ask them a million times, don't you remember I was here yesterday? And it would be like telling them to scale the Eiffel Tower, because that will not happen. So helping people understand what what Alzheimer's dementia is, and then helping people to understand that it's a need for compassion, for really, when you care about somebody, you're not going to push them, you're not going to talk loudly, you're not going to expect things to move along as quickly as you would want it to. And routines are very important to have, because the person does get used to having breakfast maybe at a certain time, or they go for walks, or whatever that activity is. They do get used to that, and they want that, and it's good for them to have that. So always having family members, if you have kids, helping them to understand that what grandma's going through, so that grandma doesn't get overwhelmed with three kids coming upon her and saying, "Oh, grandma, here I am." But they used to be able to do that, but they can't do that anymore. They need to be more gentle, more kind, more with the sensitive approach.
Right.
Wow.
Wow.
I've been overwhelmed by three grandkids attacking me for years, but I'm not a very good grandfather. Elli,
Oh.
we're running out of time, but I've got a quick one for you. We always ask our expert guests for one tip that they can give our audience to help them live a more balanced life. And in your case, I'd ask you, what advice could you give to people in their middle years, say in their 40s and 50s, that they can implement in their life to try and prevent them getting any form of dementia, or to at least delay the onset of dementia? What would be your tip for them?
It's never too late. Never too late to start a diet that is better than what you have now.
Mhm.
There are different diets that are recommended by various people. One is the Mediterranean diet, and that is more plant-based. But there are so many, just decreasing the amount of fats that we have in our system that are not good fats. Exercise is number two. And whether you do 10 minutes or 20 minutes, even 10 minutes a day, and if you can't get out of the chair, do it in the chair. Use a bunch of soup cans in your hand. If you don't have any devices, tools to do exercises, don't go out and buy stuff that you can't afford. Go in the drawer, get some soup cans, and start exercising your arms, because any kind of exercise is better than none.
Right.
And then moving your feet in the chair too, if you can't, do a lot of walking. And that socialization that we already mentioned, whether it be with those three grandkids that Peter doesn't want, with jumping upon him, to visit with someone, have people coming over, or if you are still able to, there is metro mobility, that we have people that don't have cars. They can get into metro mobility that takes them to different places.
Sure,
You can go
sure.
to church, you can go play
Great.
bingo, you can go crafting. So those three things would be the major things that
Excellent.
um,
Elli,
never, never
thank
too
you for
late.
that.
Yeah.
Thank you for that. I'll have a footnote, but Kathleen's got something else to ask you first.
Well, Elli, it's been a pleasure having you on the show today. How do people contact you?
Well, it would be via my email, which would be my full name, Elli LeClair @gmail.com, or 651-592-5320 is my cell
Okay.
phone.
We will put that in the description for our audio listeners. And if I can jump in quickly before Kathleen wraps it up, just to tell you, our audience, that next week's guest will be Kevin Palmieri, and he is the business partner of Alan Lazarus, who we had on the show a couple of weeks ago. And Alan was powerful, and from what I've read and seen about Kevin, he's going to have some really good information on how you can live a fulfilling life in all aspects. So, Elli, thank you so much for being on our show today, and thank you, our audience, for listening. And I'll hand it back to Kathleen.
Yes, again, thank you, Elli, for being on the show, and thank you all so very much for tuning in. And as if anyone actually is interested in being a guest on our show, we invite you to visit us at theyakkingshow.com. All you need to do is click on the Contacts tab and complete a short application form. We'd love to hear from you. So until next time, take care, everyone. Bye-bye.
Bye,
Thank
everyone.
you.